And frequently it went kind of like, do you believe healthcare is a human right? Well, it's not that I don't know, do you believe healthcare is a human right? Well, I'm really concerned about, no, I'm sorry, it's just a yes or no question. Do you believe healthcare is a human right? So very many of them said yes. Some of them said no. The ones that said yes, we counted as our allies and told them how happy we were to have them as our allies and showed them how many people in their district believed as they did. For the ones that said no, we let them know how many people in their district, or the people in their district, I should say, let them know that they didn't agree with them. And at one point, we had one senator, and we got this email by mistake, but it was so cool, that was sent to a constituent of this one senator who was against the bill. And he was writing to his constituents to say, if you want me to vote this bill down, you've got to do something like write me emails or phone calls, because all I'm getting is letters, emails, and phone calls telling me to vote for it. And he ultimately did wind up voting for it, even though he insisted his constituents were against it. Clearly, he was shown otherwise. So it's very effective to have a lot of people working together. And we also do try and foster leadership in each person of our grassroots movement, because it's so important to build the movement and to encourage everyone to feel that they can stand up and talk to folks that may not agree with them. And by having really simple points in this human rights, anybody can stand up and talk to anyone. And it's really a matter of staying on message, you know. If someone says, what about cost? We say the cost is in human lives. And if they say, but what about cost? We say, how much does a life cost? Very simple messaging, but most people can't answer that question. So they might walk away. Many times they then come back later on after they think about it. But it's putting the discussion on our terms of our principles that apply to people. And so what I'm looking forward to is coming back here for a celebration when you good folks of Oregon have your universal health care law passed. Because if we can get several states to do this, the federal government can no longer say it doesn't work. And I think the only way we're going to do it is at the state level, just like Canada did. First Saskatchewan, and then other provinces, and then the Canadian government said, oh wait, it does work. Maybe it does. Maybe we should do it. That's what we're going to do, and that's what you're going to do. And I am going to, at this point, turn this over to Mike for a moment and ask everybody to just stand up and stretch. Yeah, oh yeah, we're gonna have more questions after, but you can ask it now, absolutely. Yeah.
I was wondering, what kind of things do the health insurance companies do? Did they try to derail us? How did they try to derail us?
They really did. For one thing, they're working closely with IBM, who's a big employer in Vermont. And IBM had a closed-door meeting with the governor shortly before the last vote on the bill and said, you know, we're going to have to leave Vermont and that's a lot of jobs, and our economy isn't good. We're going to have to leave Vermont if this passes because we're self-insured. Well, first of all, the governor knows that IBM, self-insured, works in many other countries that have universal health care, and they don't seem to have a problem with it. And second of all, the governor said to them, there's nothing I can do. Look at the thousands and thousands and thousands of people. Look at the legislators, even the ones that said they were against it. A lot of them are voting for it. I can't do anything about it. And that really surprised everybody. And the insurance industries came to testify before the Senate Finance Committee. And actually, the president of a company called MVP, which is big on the East Coast, and which had been involved in Vermont's health care, testified right before I did. And it was really, you know, he put on this big, we really care about the people of Vermont, and we're concerned they're not going to get health coverage if we have to leave the state. Really, It was very hard to keep a straight face, but I had to because I was in the Senate Finance Committee. But they really put a lot of pressure on. Then they had insurance agents calling businesses and saying, do you know that if this law passes, you're going to pay 15% more than what you're paying now? Now that's, like, who knows where they got that from? That just got pulled out of the air somewhere. And it's, the insurance companies told their agents this is what is going to happen, so the agents were telling the businesses. Luckily, we had a lot of businesses involved because they would love to have healthy employees and not have to pay through the nose for the insurance. So in answer to your question, they did a lot, but they're going to continue. But the people can still tip that balance of power always.
You use a lot of emails in your communications with each other?
Yes, emails, phone conferences, Skype sometimes, all that sort of thing.
I know I get tons of these every day. They're passing this bill, I'm going to sign this petition. I mean, I get 3 or 4 a day.
Oh, well, yeah, no, we don't do that much. A lot of times we call.
That's not a good idea, though. They call your congressman like this and this and this.
Yeah, well, and we have organizing committees, so it goes through your local organizing committee too. So, all right, so now I'm going to turn it over to Michael.